hard to find a positive during this pandemic, but this has really driven home to all the long-term care and healthcare staff all across the continuum the importance of infection control and how making sure that they are doing everything within their power to protect the residents and their family members at home. So if there's a positive, it has to be the focus on infection control. As far as negatives go, there is plethora to choose from, but the one that I have to say that impacts everyone is the exhaustion. It's a exhausting process, and I've narrowed it down to the top three. The first one being, of course, the hours that they work. It's what for covering for their ill staff members or for whatever reason, working extra hours is exhausting. Keeping up with all the changes in the regulations is exhausting, which is absolutely necessary as well, because it is a fluid condition and nobody has dealt with this before. So it's very important that they keep up with the changes in the research and the evidence-based information, but it's exhausting. And lastly, but most importantly, is the exhaustion that comes from the staff seeing the residents that they absolutely love not being able to hug their kids, or them being the only connection to the outside world, and that's through a face mask or a face shield. And I believe that is true exhaustion. I've noted that managers who were really hands-on before have absolutely excelled in this pandemic. They've taken it by the horns, done everything they could do to make sure that their residents and their staff and their community has been safe. And those that weren't so hands-on have become hands-on, and they have learned how to get in there with their front line, evaluate their needs, and really do everything that they can to meet the needs of the front line and their residents. The leadership, one of the things that they have done, I mentioned the different changing regulations. One of the things that they've done to support everybody is education. They're not just telling them what to do, but they're telling them why it needs to be done and why these changes have to be made in order to keep COVID out of the facilities. They also work with the staff in order to make sure their schedules are accommodating. Some have worked with them with child care. All of those little things that they have done to make it just a little bit easier on those that their staff. It's no longer a mentality of management versus frontline. It's now everybody versus COVID.